Hi, Bill. Hi, Shona. Hi, Pax and Aaron. My name is Julia, and I'm here to talk to you about diabetes and our warming world. So we've been learning all about climate change this past semester, how our global temperatures are rising as a result of fossil fuel consumption, linked to greenhouse gas emissions, and how that is impacting our daily life. We've seen an increase in severity and duration of extreme weather events like flooding, drought, wildfires, and extreme heat. So we are seeing these long-term trends over about 30 years. We can look at those trends to separate them from weather to say that yes, temperature is steadily increasing. And as average global temperatures rise, so too do rates of diabetes. So the International Diabetes Foundation estimates that there are currently 537 million people living with diabetes today worldwide, aged 20 to 79. And this number is expected to rise to 629 million people by 2045. And while this increase in number could be due to improved diagnostic tools, improved screening of prediabetes, and increased life expectancy for those living with diabetes, it could also be due to increased obesity rates, our sedentary lifestyles, environmental factors. So I wanted to explore this topic because I have a personal connection to diabetes. My mom was actually recently diagnosed with prediabetes, and I knew nothing of diabetes except for sugar. And so I wanted to learn more about the pathophysiology, what ways I could support her, and how her future could be affected by our changing world. So what is diabetes? Well, diabetes is a chronic condition where the body's unable to produce enough insulin, or it can't properly use the insulin that it does produce to carry out normal body functions. So insulin is a transport hormone from the pancreas that takes glucose from the blood into cells to allow for normal cell function, metabolism, processes, and it also controls glucose levels. So normal glucose is controlled via negative feedback systems. And a negative feedback system consists of some sort of receptor that's monitoring internal or external changes that sends input to an effector, input to an integrator, which then determines what kind of output needs to go to an effector, which is what makes a change. So glucose homeostasis is achieved through secretion of insulin, which lowers blood glucose levels, and glucagon, which raises blood glucose levels. And in diabetes, these processes are impaired. So there are two main types of diabetes. Type 1 is a smaller portion of the diabetic population, about 10%. And in this type, the pancreas is unable to make insulin. This is due to damage to the beta cells within the pancreas that synthesize and secrete insulin. It's thought to be an autoimmune response where the immune system attacks those beta cells. People with this type of diabetes, type 1, need insulin injections to survive. Type 2 makes up the majority, about 90% of the diabetic population, is thought to be linked to obesity, lifestyle factors, and genetic predisposition. It results in insulin resistance, where the insulin produced becomes less effective, which causes the pancreas, those beta cells, to make more and more and more insulin, overworking them and causing them to eventually fail and lowering their insulin making abilities. So impaired insulin production in both type 1 and type 2 diabetes can lead to hyperglycemia or high blood glucose levels. And long-term hypoglycemia can have all sorts of effects on a diabetic's health, including endothelial dysfunction, breakdown of cell membranes, circulatory problems. These can lead to heart attack, stroke, chronic inflammation, kidney failure, and neuropathy, which can also lead to infection or injury, which is why you may see some diabetics with missing limbs, with amputations. So symptoms of type 1 and type 2 diabetes, and also a good diagnostic tool, are the 3 Ps. Polyuria, which is frequent urination when the body is trying to excrete some excess glucose. It takes water and electrolytes with it, causing dehydration. 2 is polydipsia, where the body is trying to replenish some of those fluids by being constantly thirsty. And 3, polyphagia, increased hunger to kind of make up some of that glucose lost for, so it can use that new glucose in metabolic processes. So how does this relate to heat? Well, as humans, we are endotherms, which means that we generate heat internally to maintain thermal homeostasis. And homeostasis is a state where all of our body systems are constantly working together to maintain constant optimal limits of different physiological measures. So for temperature, this optimal range is 36.5 degrees to 37.5 degrees. So in heat, we have peripheral thermoreceptors in our skin, and we also have central thermoreceptors throughout the body. And these will sense internal or external changes in our internal environment or external environment and send that input up to the hypothalamus, which is our thermostat of our body. And the hypothalamus then sends an output to sympathetic nerves, which cause vasodilation, sending blood to the skin. And then there's heat exchange between the skin and the air, or else to sweat glands, which will sweat, and the evaporation of sweat off the skin has a cooling effect. So that is one or two ways, I suppose, that humans cool themselves. And so in diabetes, these processes, these thermoregulation systems are thought to be impaired. So the pathophysiology that links diabetes to heat is not very well understood yet. It is an area that we need to improve our research and studies because temperatures are rising, rates of diabetes are rising. We need to know how these really affect one another. There are correlations between the number of emergency department visits in patients with diabetes and increased mortality during heat stress events, which suggests that their impaired thermoregulatory systems are causing them to need to seek hospitalization. So factors that contribute to disrupted thermoregulation include the impaired vasoconstriction and endothelial dysfunction, increased risk of dehydration and neuropathy that diabetics already face. So that heat stress is going to enhance and exacerbate all of these things that they already experience. So first off, endothelial dysfunction is thought to be related to reduced levels of nitric oxide in the body and also to the hyperglycemia that diabetes patients experience, which impair circulatory systems and compromise their ability to thermoregulate through vasodilation, which I spoke about before, that heat exchange from the skin, from blood going to the skin. Also, inflammation and the endothelial dysfunction can result in increased risk of heart attack and stroke. The next thing I want to talk about is dehydration. As I mentioned earlier when I spoke about the 3 Ps, diabetes patients are prone to dehydration, especially in heat, due to their hyperglycemia and their body trying to get rid of all that excess glucose. Their body's getting rid of water they need, electrolytes they need, and so they're prone to dehydration. Also, common medications that diabetics take, including diuretics, further cause urination, leading to even further dehydration. Fluid and electrolyte imbalance can lead to fatal heat stroke, heat exhaustion, and impaired kidney function. So people with diabetes really need to be careful that they're maintaining electrolyte balance and getting enough fluids, but not too many fluids that they are going to need to frequently urinate. Heat-related hyperglycemia can also exacerbate neuropathy or nerve damage, which we spoke about briefly before. One way that it does this is it impairs the sweat glands' ability to function properly, which, as mentioned, sweating is a means of cooling and thermoregulation. That evaporation cools the body. And so when we can't do that, we can overheat. Another thing that diabetics need to be careful about in heat stress is their equipment and their medication. Insulin needs to be stored at a cool temperature, about 2 to 8 degrees Celsius when it's unopened, which may not be possible all around the world if people don't have access to refrigeration. So this is something that people really need to consider. Also, test strips and pumps sometimes have impaired efficacy in really hot temperatures. In conclusion, with temperatures on the rise and rates of diabetes on the rise, people with diabetes really need to take care in times of high temperature due to their impaired cooling immune systems. They're at risk of endothelial dysfunction, further dehydration and neuropathy, and all these things may hasten fatal heart attack, stroke, and renal failure. A consequence of climate change on patients with diabetes is that they may be displaced, they may have to move, they may have to seek out alternative means to keep their medications safe and effective. And there are some strategies that they can use in order to stay healthy. One is that physicians really should be developing some sort of heat plan for their patients so that they know appropriate behaviors and medical or storage of their medicine and equipment use in heat. They should work with their patients to educate them and make them aware that this is an issue and an issue that will become more prevalent in the future. People with diabetes should also make sure to invest in cooling technology, fans, air conditioners, cold compresses. They should also know where around where they live, they can access air conditioning, public spaces that they can access to cool themselves. And as public, we should be checking in on our neighbors, our family members, our friends, the elderly with diabetes, especially in times of heat, making sure that they are healthy and well. And yeah, by wearing protective clothing, hats, sunglasses, staying in the shade, avoiding going outside during peak hours, eating well, exercising appropriately in the heat, by exercising indoors, people with diabetes can live long and healthy lives, even as our future seems hot. So stay cool. Thank you for a great semester. I learned a ton and I really enjoyed the class. Bye, everyone.